Imagine this. You start taking a medication for a common ailment. It's something your doctor prescribed, something you trust will help you. It's supposed to help you sleep better, feel more at ease. You expect it to bring you relief, to make your life a little easier. Then your life changes in ways you never imagined. Suddenly, things start to feel different, unsettling. You're overcome with urges you can't control. These aren't just fleeting thoughts, they're powerful, overwhelming compulsions. You engage in risky behavior, jeopardizing your relationships, your finances, your very sense of self. The things you once valued seem to slip through your fingers. This isn't a horror movie plot. It's the reality for some women taking dopamine agonists, drugs commonly prescribed for conditions like restless leg syndrome. These medications are meant to help, but they come with a hidden cost. These medications, with names like ropinirole, are designed to mimic the effects of dopamine, a neurotransmitter associated with pleasure and reward. They alter the brain's chemistry in ways that can be both beneficial and dangerous. While they can be effective in managing the symptoms of certain neurological disorders, emerging evidence suggests a dark side. Dopamine agonists may be linked to compulsive behaviors, particularly in women. This side effect is not just a minor inconvenience, it can be life-altering. Some women report experiencing hypersexuality, engaging in risky sexual encounters they wouldn't have considered before. These actions can lead to feelings of guilt, shame, and confusion. Others describe an uncontrollable urge to gamble, leading to devastating financial losses. The compulsion to gamble can be so strong that it overrides all rational thought. The most alarming aspect? Many of these women claim they were never warned about these potential side effects. They were given the medication with little to no information about the risks involved. They were left to grapple with the consequences of their altered behavior, feeling alone, ashamed, and betrayed by the very healthcare system that was supposed to help them. The emotional toll can be as devastating as the financial and social consequences. The stories of these women raise urgent questions about the adequacy of current informed consent practices, the ethical responsibility of pharmaceutical companies, and the desperate need for greater awareness and support for those affected by this little-known side effect of a commonly prescribed drug. It's a call to action for better communication, more comprehensive research, and a healthcare system that truly prioritizes patient well-being. Restless leg syndrome, or RLS, is more than just an inconvenience. It's a neurological disorder that causes an irresistible urge to move one's legs, often accompanied by uncomfortable sensations. These sensations can range from tingling and itching to a creeping or crawling feeling that makes it nearly impossible to stay still. The urge to move is often strongest in the evening or at night, making it difficult for sufferers to get a good night's sleep. For many, the symptoms worsen at night, interfering with sleep and leading to exhaustion and daytime impairment. This lack of restful sleep can result in chronic fatigue, making it hard to concentrate and perform daily tasks. Over time, the constant sleep disruption can take a toll on one's overall health, leading to a cycle of sleeplessness and stress. The condition can significantly impact quality of life, affecting work, relationships, and mental well-being. The constant discomfort and lack of sleep can lead to irritability and mood swings, straining personal and professional relationships. Many individuals with RLS also experience feelings of isolation and depression, as the condition can be difficult for others to understand. Parkinson's disease, a progressive neurodegenerative disorder, presents a different set of challenges. Unlike RLS, which primarily affects the legs, Parkinson's disease impacts various motor functions and can lead to a wide range of symptoms that progressively worsen over time. Tremors, stiffness, slow movements, and difficulty with balance and coordination are just some of the debilitating symptoms that gradually worsen over time. These motor symptoms can make everyday activities, such as walking, dressing, and eating, increasingly difficult and can lead to a loss of independence. The impact of Parkinson's disease extends beyond the physical. It can lead to depression, anxiety, sleep problems, and cognitive impairment. The emotional and psychological toll of living with a chronic, progressive illness can be profound, affecting not only the individual, but also their family and caregivers. For individuals living with these conditions, finding effective treatment is paramount. Managing symptoms and improving quality of life often requires a comprehensive approach, including medication, lifestyle changes, and support from healthcare professionals. Dopamine agonists, Medications designed to mimic the effects of dopamine in the brain have emerged as a common treatment option. These drugs can help alleviate some of the motor symptoms associated with Parkinson's disease and provide relief from the uncomfortable sensations of RLS. While they can provide relief from the debilitating symptoms of RLS and Parkinson's disease, their use has been increasingly linked to a range of troubling side effects, including the development of compulsive behaviors. Patients may experience issues such as gambling, shopping, or eating compulsively, which can further complicate their lives and require additional management strategies. Dopamine, often referred to as the feel-good neurotransmitter, plays a crucial role in our brains. It's involved in a wide range of functions, including movement, motivation, reward, and pleasure. When we engage in activities we enjoy, like eating a delicious meal or achieving a goal, our brains release dopamine, creating a sense of satisfaction and well-being. In conditions like Parkinson's disease, the dopamine-producing cells in the brain gradually deteriorate, leading to a deficiency of this vital neurotransmitter. This deficiency contributes to the hallmark motor symptoms of the disease. Dopamine agonists, as their name suggests, work by mimicking the effects of dopamine in the brain. They bind to dopamine receptors, stimulating these receptors and helping to compensate for the reduced dopamine levels. For individuals with restless leg syndrome, the exact mechanism of action of dopamine agonists is less clear. However, research suggests that they may help regulate dopamine signaling in areas of the brain involved in sensory processing and movement control, thereby alleviating the uncomfortable sensations and urge to move that characterize the condition. "I was a different person," Sarah confessed, her voice barely a whisper. She could hardly recognize herself in the mirror anymore. The reflection staring back at her was a stranger. Before taking ropinirole for restless leg syndrome, she was a devoted wife and mother, content with her life. Her days were filled with laughter and love, her nights peaceful and serene. Then the medication's insidious effects took hold. What was supposed to be a solution to her restless nights turned into a nightmare she couldn't escape. An insatiable hunger for excitement gripped her. It was as if a switch had been flipped, and she was suddenly chasing thrills she never knew she craved. She started gambling online, small bets escalating into reckless wagers that drained the family's savings. The thrill of the gamble became an addiction, a dark shadow over her once bright life. Her once loving nature transformed into something unrecognizable. The warmth in her eyes was replaced by a cold, distant stare, and her gentle touch became a memory. She craved attention from other men, engaging in risky liaisons that left her feeling empty and ashamed. Each encounter was a desperate attempt to fill a void that only grew larger. Sarah's story is not unique. Many women have found themselves on a similar path, their lives upended by the very medication meant to help them. Countless women have reported experiencing similar disturbing changes after taking dopamine agonists. These medications, while effective in treating certain conditions, come with a hidden cost. The medication intended to improve their quality of life instead plunged them into a spiral of self-destruction. The promise of relief turned into a curse, leaving them in emotional turmoil. They described feeling powerless against their urges, their lives hijacked by compulsions they couldn't control. The battle against these urges was relentless, a constant struggle that left them exhausted. These women, once active participants in their own lives, became entangled in a web of addiction and despair. Their dreams and aspirations were overshadowed by the chaos that ensued. The medication, meant to bring relief, instead brought chaos and heartbreak. The emotional pain was unbearable, and the sense of loss overwhelming. Their stories serve as a stark warning about the potential dangers lurking beneath the surface of seemingly benign medications. It's a reminder that what is meant to heal can sometimes harm, and that awareness is the first step towards